Hi there again, Dr. Patanzi, as we make another YouTube for you all to watch and hopefully appreciate. This young lady is Brooke. Brooke is in from Florida. She flew in Thursday.
Yeah.
This is Saturday. She already had her first treatment yesterday. I would appreciate if you gave a little history of what you had and why you felt it's necessary to come from Florida to here, if you had other chiropractors, what happened, what's going on.
So basically my left shoulder has been in constant pain for the last 4 years. I have tried everything. I've seen doctors. I saw massage therapists for a year. I did physical therapy. I've taken anti-inflammatories. And I saw I've seen other chiropractors, and they've adjusted basically like everything but my shoulder, even though it's like, this is where it hurts, and just like crack my back or whatever. I saw my second orthopedic surgeon like 2 months ago, and he basically told me to change careers and like not ever worry about using this arm ever again. So I started crying in his office, and my husband had been watching your videos for like a year, and he said, "Okay, we've got to go to Colorado." So we booked the flight.
Wow. You had your first treatment yesterday. We found a lot of stuff, didn't we?
Yeah.
And then you had Wes, the physical therapist, do the functional activation, firing all your muscles that had shut down. Structural out of alignment for all these years. The brain accepts it and gets used to it, but there's no energy firing. It's shutting down her innate intelligence, her healing power. Hard to sleep, hard to think, depression, oh my God, what's going to happen, blah, blah, blah. You've been to different chiropractors, but they've never adjusted here. Mm-hmm. Well, that's just a bit interesting and disturbing. And I don't want to go on to my rant about the type of chiropractic you're getting. Okay, but if you people, 3 million of you who watch this video and watched all the other videos, and you 9,000 subscribers, and there have to be many chiropractors, please understand. Okay, if you didn't learn it in school, you didn't learn it in a seminar, how to use your hands, adjust, okay, and be a bone setter. Structural alignment. Your goal should be balancing the spine in an upright position. Saying that, you had your first treatment yesterday. Are you better today?
Yeah, I mean, yes, it feels way better, especially in the very back where it was hurting the worst.
It's hurting the worst here, interscapular, midscapular, on the left, indicating AC joint, C5, shoulder girdle was completely misaligned, positive Deerfield, anterior right pelvis with the left short leg, twisted spine with convexity in the dorsal spine indicating an acquired scoliosis. So her energy is not flowing. It shows she's in a lot of pain, but the energy shut down. So today I'd like you to take your shoes off and see what we have today. Patients, go to your chiropractors. Say, hey, look, watch this video. Why are you doing what you're doing? What is your goal with me? Well, wellness. I want to just keep you well, but I'm not well yet. Okay, well, let's fix your symptoms. Well, are you a symptom chaser? Example, shoulder pain, shoulder surgeries. Surgeons never look at the shoulder girdle. The shoulder girdle houses the head of the humerus. Shoulder girdle's out of alignment, twisted. The head of the humerus is sitting crooked. So you fix the shoulder, fix the labrum, do a new shoulder. You still put it in it. You put the new shoulder, the new humerus, in an out of alignment shoulder girdle. So fix the shoulder girdle. Okay. What's the shoulder girdle connected to? Cervical dorsal spine. All right? Sternoclavicular joint. What's the cervical dorsal spine connected to? The thoracic lumbar spine. Lumbar pelvic spine. Hips, knees, feet. God made us, fortunately, unfortunately, upright in gravity. Okay? This is what we have to deal with and live with. And gravity is always forcing us down and throwing us out of alignment. So you patients, go to your chiropractors. Just say, do GPA, will you? Fix me. Make my goal perfect posture. Okay. You ready?
Ready.
All right, just kind of stand here and let me see. Yeah, you can face the camera.
Okay.
If you look at her feet, yesterday, was the left foot way forward? The right foot.
The right foot.
Put your right foot way forward.
Was kind of
The right foot was way forward, turned in. I had her close her eyes, and get comfortable. Okay? Well, now to get comfortable is balanced. But it was, even when she closed her eyes, the misalignment stayed. See, when patients come in, you can have patients open their eyes. Okay, stand, let me check your posture. Well, if they're open their eyes, visually, they balance themselves. Now, if you have them close their eyes, you become a little, wait a minute. So she switched and put her right foot out. She had her right foot forward, but she had a posterior right pelvis with an anterior right hip. And this was real high here in the second rib area. Sternoclavicular joint, the clavicle was up, I think, about an inch, right? Mm-hmm. And the occiput was way out, and the first cervical was so tender I couldn't touch it. Better today?
better.
She's going to do very well. She needs maybe 6 visits to get her corrected, maybe 8. All right? Then what? See me every month to maintain, okay, your upright alignment. True wellness. Get you well, maintain your wellness. Thank you, doctor. Now, when the word gets out, this is what you do, rather than seeing somebody 3 times a week for 42 weeks. And I know it happens because I'm on a board that evaluates these things. Aren't you more happy chiropractor and feel more contented spiritually and professionally if you get these results? Oh my God, thank you, doctor. Isn't your income and your success based on your results with your patients and your service you give to them? Okay, there's millions of people to be seen. Quit seeing the same one 100 times a year. Sorry, that's not necessary. Okay, let me see now. Yeah, okay, right here. All right. Oh man, I knew you should have come in yesterday, photographer. She's all fixed now, but we're gonna. All right. Wow, you're even here, aren't you?
Yeah.
Okay.
Much better.
Was it this arm, right?
Yeah.
Yeah. So she has a little bounce in her first and second rib. She's a little high, maybe 1/8 of an inch in her left sternoclavicular joint. Left scapula is high. Left clavicle's high. It's about 80% better than it was yesterday. So I treated her yesterday a mess. I said, I need to see you today. So she comes in today. The mess is gone. Okay? Why? One visit, I changed the foundation. The foot. Changed the foundation. Freed the hips. Balanced the sacroiliac and pelvis. What did Desjardins say? The relationship. Okay, sacrum, occiput, sacro-occipital. It is extremely important. How many ligaments and muscles attached to the pubic bone? Numerous, adductor, magnesis, pectineus attached to the pubic bone. What, 10, 12 pair of ligaments inside the pelvic wall? And you're cracking the back indiscriminately? All right, enough. Face down, please. Right leg today is, your husband would love this, is about 3/8 of an inch. You want me to pull her socks down?
Sure.
Yeah. Is that better? Yesterday it was 1.5 inches or something. Brookie, wasn't it?
Yeah.
Yeah. All right. If you look at the right Achilles tendon, it's thicker. Still tender?
Yeah.
Less than yesterday?
Yeah.
Yesterday I squeezed her Achilles tendon. Okay, the Achilles tendon was this thick, this muscle big and strong, a flaccid left gastrocnemius and calf. Okay, this tendon's narrow, this tendon's thick. She had a right short leg. Then we did a Deerfield, it turned the left short leg. We'll see that in a second. This muscle's overdeveloped because she's leaning to the right and putting all the pressure here to balance herself. That's why this foot was way out here, and when she stood, the foot was forward like that and was flared out. She's trying to balance herself. Pedal foundation. All right. And we have a positive deer field again. When I bend the knee, you'll see that the right heel is higher than the left. I'll just do this so you can see. Okay? Then, when I do this, the right leg is shorter than the left. That's a positive deer field. About 70 to 80% better result than yesterday. Now we'll do dorsiflexion on both feet. What am I checking for? Restriction, range of motion. I have excellent range of motion in dorsiflexion. It goes to the extreme where I consider normal. There's a smooth dorsiflexion on the right, okay, where on the left, the foot wobbles. So the talus bone, real tender here, the talus bone on the left is jamming against the probably distal end of the tibia and also the calcaneus. I don't know exactly what it's doing, but it doesn't allow smooth tracking dorsiflexion. And that's on the left foot. Then we check the plantar flexion. Wow, good. Plantar flexion of the right. You'll see the folds in the skin. Okay, on the left, there are no folds. So the navicular is dropped, and it's not allowing me to dorsiflex the left foot. This is the same foot that I believe, because of the abnormal dorsiflexion, that you have a talus bone that's out of alignment. So it's the talonavicular. They're not lined up. It's not her fault. The foot does this by itself because it's trying to balance the upper body. Bipedism, gravity, upright, pulling them down. These feet are working all they can work to make her balanced so she can perform, she can walk and maintain balance. Bend both knees. Okay, much better. Yesterday, this one was here and this one was here. The right foot is about 5 degrees closer to the buttock than the left. Okay, so good and restricted. Is it the knee or is it the quad? In the quadratus, if its origin insertion extends the muscle, makes it longer, it has less flexion. It outstretches. Okay, I think it's the pelvis. I think her knee is fine. So why don't I put a wedge under her right pelvis? Belt line, not hip. If the pelvis is anterior here, I'm bringing it posterior. If the pelvis is anterior, naturally the head of the femur becomes posterior. So the head of the femur will be back here. Well, this was way anterior. So I put the wedge in. Now I bend both knees. Whoa, perfectly symmetrical. Actually, this one's tighter. Right? So it's not her knee. The restriction and flexion is coming from her pelvis being out of alignment, shifting the hemipelvis, causing the origin and insertion of the quadratus to be greater distance, which stretches the muscle and restricts the knee flexion. That's for chiropractors and you other patients who are watching this. Bring this up to your chiropractor. How about my short leg, my pelvis? Make them change. Let there be a movement. All right. So, let's take this out a second and see if the neck is still involved. Again, I took the wedge out. We have a right short leg and we have the left. So that's a deer field. Is the neck involved? Would you please turn your head to the right? The left leg stays short. Would you please turn your head to the left? The left leg stays, it moves a little. Give the body about 10 seconds. Innately, the body's changing. So she has a mildly positive deer field, face down. Now the left leg gets a little longer. So the deer field in the neck, which is the non-compensatory in GPA, so you have to fix it before you fix anything else, okay, indicates that there's a fixation in the neck and a positive deer field. What's a positive Deerfield, in my opinion? Why is it when I bend her knees or look at her leg lengths and I have her turn her head right and left, the pelvis shifts? Because the belief, confirmed hundreds of years ago by chiropractors, is the occiput articulates with the sacrum. Each vertebra works independently but in unison in a kinetic chain with all the other vertebrae. If there are two or more vertebrae, okay, locked in the occipital cervical spine, when she turns her head, those two vertebrae shift together, which causes an abnormal shift, and the other vertebra can't compensate, so it shifts at the sacrum. That's a Deerfield. Tremendous importance, relationship between sacrum, occiput. Significant. David Palmer said so, Dr. Jancy said so, B.J. Palmer said so. They also said, find the right vertebra, correct it in the right position, balance the spine, find the right vertebra, adjust it in the right way, the right direction, the right speed, reposition it the right way to turn on the power. The big problem has been what's right. So if you have a system that can't be denied, an objective structural system of bioengineering, that you stand, okay, and your body goes out of alignment, the body's telling you what's wrong. Forget the symptoms for the most part. Rule out what you need to. Have other therapy equipment in your office to take care of symptoms. But you got to figure out exactly why the shoulder's hurting and is positive Deerfield. Eliminate the non-compensatory things, then balance the spine in an upright position. You're going to be a hero and you're going to save many people, in my humble opinion. All right? Okay, so it was minimal to the left. The Deerfield changed just a little bit in left cervical rotation. So I have to go and check it. On your back, please. As I palpate mastoid bones, the right mastoid is about 30 degrees posterior superior, indicating her occiput is sitting up and back. Yesterday it was 50 degrees. That then causes C1 on the opposite side to rotate posterior to compensate for the occiput. That also, we had those temporal bulges yesterday and your TMJ. Also yesterday, her chin was not lined up with her nose, because when the occiput C1 is out, the TMJs are affected. And the jaw mandible shifts. And she had a left temporal bulge. Those are gone. You have a real straight face today.
Yay.
Her husband said thank you. Okay. All right, but he said it doesn't matter. He loves her anyway. No. All right. So we have a right posterior occiput, and in left cervical rotation, we had a change in the leg length in the Deerfield. So turn your head. Okay. This is about 20 degrees. So I turn the chin 20 degrees, tap the occiput. I turn the chin 20 degrees, tap the occiput. Wonder if it was 45 degrees, like it was yesterday. Well, I'm going to come in with a wedge. Put the wedge under the left belt line. Put the wedge under the left belt line. This was the posterior pelvis. Okay, I contend that this is related to the occiput. You wait 10 seconds, minimally. You raise that pelvis on the left to bring the posterior pelvis anterior. Things shift, and now the occiput balanced out. I know I did it out of order. I'm saying what happened yesterday. When I put this in yesterday, I'm uncomfortable trying to adjust her occiput like that. I'm sorry. I'm not a full range of motion adjuster because I'm stretching the vertebral artery. I'm closing up the facets on one side and I'm opening everything up on the other side. I'm encroaching the nerve roots on one side and I'm opening them up on the other side. Why is that necessary? Quick twitch recoil. Okay, 15 degrees, boom, 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 boom. Okay, not You patients know exactly what I'm talking about. I have more patients coming in here saying, my neck, you have to do my neck. I go, trust me. it'll be different than what you've experienced before. Okay, because of the right posterior occiput, I'm getting a reaction from the crowd like it's happened to you before, hasn't it? Crowd, yeah. There's a crowd here, by the way. They're just quiet. So then we'll go to the left atlas, okay? Because if the right occiput goes, left atlas. So again, bingo. And I see some videos, and there's some chiropractors, tremendously quick hands. Praise God. Thank you. Thank you. Choom! Free in the atlas. Just make sure it's not the only thing you free. You gotta, the atlas is out of alignment. Is it primary? Did they have a concussion like some of the Bronco players I take care of? Did they knock their head out in an accident? Did they have a bad whiplash? Did you check to see if they're out of alignment up to the head? If you didn't, how do you know it's primary? And if it's not primary, do you think you're going to fix the rest of the spine by doing occiput C1? Well, you can, if that's your gift. My gift, I'm not that good, where I can go do an HIO, occiput C1, and the whole spine straighten out. Okay? I can see a few things changing, but I can't see the bones in the feet changing. Can you? Unless you have the gift. You know, Jesus Christ was one of the first chiropractors. All he had to do is go, align, heel, boo! People get up, they're so subluxated they're dead, but he woke them up just with, in my opinion, his adjustment. Then he realized after a certain period, I better just touch these people and align them. Well, he's not here. And if that is your gift where you're so powerful, boom, then I want to come to you. Please let me know who you are. Nevertheless, all right, now, what I had her do, breathe deeply through your nose, blow it out. Deeply through your nose, blow it out. Post-concussion syndromes. I've had 850 NFL athletes since in 40-some years of my 46 years of my practice. I've seen thousands of concussions before it was a major issue. Always left posterior C1. Don't ask me why. This is what I find. Right posterior occiput, left posterior C1. The C1 on the left seems to be the switch of the brain. When you get your blow to your brain, C1 goes out, left temporal bulge. There are some exceptions. This is 99.8% of the, I'm just telling you. Okay? So, if it's a concussion and that happens, obviously then C1 has a definite impact on the brain. Okay, so we do the cranial adjusting. Okay, bring this arm up, hold, don't let me push. I will do certain parts of the skull and muscle test to find out if any other plates are out of alignment, not necessary. Okay, then you have a TMJ. Dr. Heron taught me a lot about TMJs. The guy's genius. If you have any chance to take his course, pay whatever it is and take it. It'll change your whole chiropractic career like it changed mine. So open your jaw and close your jaw. It's smooth. The other day, she opened her jaw and it deviated. So you push down on the jaw and let the bilaminar disc slide up over the condyle and it resets it. Okay? What she had the other day was painful on the right, correct?
Yeah.
It's not painful. So it's good. I had some changes. And to correct the TMJ, relax, get your piezoform, boom, 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 not whatever. All right? Now come up for me, kid. Face down. She left Florida, it was 90 degrees, and we're in Colorado today, and it's 45, so you have to feel a little sorry for her. All right? Now I'm going to raise the table. I have this Lloyd table that I bought 15 or 20 years ago for a lot of money. Oh, Lloyd, thank you. I got a drop table. I hit a thing that cocked all the table and cocked all the pieces so I can adjust all areas of the spine. It's vertical, goes up and down. It doesn't break down, rarely. Okay, saved me in my career. Save me so I'm not bending. Okay? Thank you, Lloyd. All right, now, leg lengths. I'm still about 3/8 of an inch short. Bend both knees. Symmetrical. Okay, one more time. Symmetrical, but watch the left foot. The left foot will turn in. Okay, as I'm flexing her knee, I get to about 120 degrees and the left foot goes in. That's hip. So when I got to a certain point, her hip said, sorry, I'm not moving in that direction. So it told me it goes in this way. It wants to be an external rotation, which means it's lacking internal rotation. Okay, now let's go back to her feet. Dorsiflexion. Still, I have an abnormal tracking in the left foot. I have a right Achilles tendon now that actually feels pretty good. Okay, you remember when we measured it before? It was thick. Now it's thin. Yesterday it was like double, triple this. Because yesterday this tendon was flatter, which gave it a thickness. It wasn't truly thicker or bigger, but it was flatter because calcaneus was back, navicular was dropped, talus was elevated, and this tendon is trying to hold on to this foot. So if she's a big exercise person or football, baseball, basketball, soccer, hockey player, and this tendon's under this much stress, are you going to have plantar fasciitis? Most likely. Are you going to have heel pain and heel spurs? Most likely. Or you have a greater potential of tearing your Achilles tendon because this is so stretched and flattened out and all the pressure's here. This leg was like a rock. And that's just not her. That's anybody and everybody that's out of alignment from the feet up.